There's a question most guys won't ask out loud, not to their doctor, not to their friends, maybe not even to themselves. What happens if you masturbate every single day? You've probably heard whispers, scary ones, that it might ruin your health, damage your prostate, cause cancer, or make you less of a man. The internet is flooded with warnings. Some of them sound convincing, others just feed fear. But here's the twist. Most of what you've heard, it's wrong. Not just a little wrong, completely upside down. Today, you're going to find out what daily masturbation really does to your body, specifically your prostate. In fact, it might shock you, because science has a story that no one seems to be talking about. So stick with me, because the end of this video might change the way you think about your own body forever. Let's start with the basics. What the prostate is and why it matters. The prostate is a small gland in men, roughly the size of a walnut. It sits just below the bladder and surrounds part of the urethra, the tube that carries urine and semen out of the body. One of its main jobs is to produce a fluid that mixes with sperm to create semen. This fluid helps sperm survive and move. Despite its small size, the prostate plays a crucial role in male health. As men age, the prostate often becomes a source of problems. It can enlarge, leading to symptoms like needing to pee frequently at night, a weak urine stream, or difficulty starting or stopping peeing. In more serious cases, prostate growth or irregularities can develop into prostate cancer, one of the most common cancers in men. That's why understanding this gland and how lifestyle affects it is so important. For decades, many people believed that frequent masturbation could harm the prostate. The logic seemed intuitive. If you use the gland often, perhaps it inflames or wears out over time, leading to risk. But when researchers finally looked closely at this assumption, they found something unexpected. Massive long-term studies, including one led by Harvard-affiliated researchers, followed over 30,000 men for around 20 years. These men kept detailed logs of their ejaculatory habits and overall health. What they discovered was striking. Men with frequent ejaculation habits had a significantly lower risk of developing prostate cancer than men who ejaculated less often. Specifically, men who ejaculated 21 or more times per month had up to a 33 to 36% lower chance of being diagnosed with prostate cancer compared to those ejaculating fewer than 4 to 7 times a month. This protective benefit was especially pronounced in men under age 70. That alone might sound surprising, but other research supports the same pattern. An Australian study of more than 2,300 men found that ejaculating 4.6 to 7 times per week, so roughly 20 to 30 times a month, reduced prostate cancer risk by around 36% compared to men who ejaculated less than 2.3 times per week. So, the evidence is consistent. More frequent ejaculation through adulthood correlates with lower prostate cancer risk. Why might this happen? There are a few possible explanations. 1. A spring cleaning effect. The prostate has tiny ducts that retain fluid, cells, and waste. If you don't flush them regularly, these can build up, become inflammatory over time, and may trigger abnormal growth. Ejaculation effectively clears out that buildup before it leads to trouble. 2. Renewing prostate cells. Every time cells divide, there's potential for DNA damage or mutation. Regular ejaculation may help push out older cells and promote turnover, reducing the chance for harmful mutations. Think of it as pressing a reset button on part of the prostate. 3. Stress reduction and inflammation control. Chronic stress is known to raise inflammation throughout the body, and inflammation is a recognized risk factor in cancer. Sexual release, especially masturbation and orgasm, triggers the release of feel-good hormones like dopamine and oxytocin. These lower stress and inflammation, which supports overall prostate health. These theories aren't fully proven, but they offer compelling explanations that fit observed outcomes. That said, it's essential to be clear. This connection is about correlation, not guaranteed prevention. Men who ejaculate more often might also have healthier habits overall. They may exercise more, eat better, maintain healthy weight, and pay attention to medical checkups. So daily ejaculation alone isn't a magic cure. Which brings us to other important habits supporting prostate health. Diet matters. Foods rich in lycopene, such as tomatoes, watermelon, and pink grapefruit, have been linked to lower prostate cancer risk in several studies and meta analyses. Higher dietary or blood lycopene levels were associated with reduced risk, relative risk around 0.88 in some analyses. Omega-3 fatty acids found in oily fish like salmon are believed to have anti-inflammatory effects. Some large observational studies suggest dietary fish intake may reduce prostate cancer mortality, though links to incidence are less clear. Stay active. Even moderate exercise, like a daily 30-minute walk, helps reduce cancer risk by improving circulation, lowering inflammation, and supporting healthy weight. It's a clear win for prostate wellness. Avoid smoking and limit alcohol. Both smoking and heavy drinking have been tied to increased cancer risk, including prostate cancer. Cutting back supports better overall outcomes. Regular screening. If you're over 40 or have a family history, getting a PSA blood test can help detect prostate issues early when they're most treatable. Just note, PSA levels can be affected by recent ejaculation, cycling, or infections, which is why doctors interpret trends, not single values. In summary, daily masturbation could be one helpful piece of a broader puzzle. It may support prostate health by flushing out fluids, promoting cell turnover, and reducing stress, but it's not a standalone solution. Healthy eating, exercise, screening, and avoiding harmful habits all form part of a stronger long-term defense. South today, you learned how daily masturbation really affects your prostate. Subscribe to know everything about your body. Take care of yourself, stay curious, and don't believe everything you read on the internet unless it's backed by research.